over 80% women can actually deliver normally. Vaginal birth is supposed to be 8 times safer both for mother and baby, much better. Delayed cord clamping means that after the baby is born, there is still blood flow from the mother, from the placenta to the baby, and we deliberately wait for about, it varies from about 50 seconds to about up to 5 minutes, but on average about 3 minutes. So we let the blood flow from the mother to the baby.
Under the pre-planned C-section, what are some of the risk factors that would have the mother go through cesarean?
Under the planned C-section indications, commonly are women who have carrying a baby more than one, the twin pregnancies and triplets. Triplets are rare here, but twin pregnancy is common. Women who has, in addition to pregnancy, with heart disease, diabetes, or the baby is too big to deliver by a normal route, or there is any condition with the baby that commonly we call it preeclampsia pregnancy, which affects the baby, and the baby has not obtained a potential growth, so growth restricted babies. These are some of the common indications that we put them for planned C-section.
In case of a baby who is in a breech position, would the hospital consider C-section?
Yes, very much. I actually miss out that breech baby. Breech baby are those babies who are presented by bottom first, when the head up, when the woman has actually completed her pregnancy duration of 40 weeks. So like elsewhere in the whole world, after a famous study, it is called term breech trial, where they found out that babies who are presented by breech, if they are to be delivered by cesarean section, they do much better with less complications. And to this day, now we have been about over 15 years, all breech babies in the world are delivered by C-section. And that comes under the planned section.
Why do they think it's easier to go for C-section? It's a major operation, Mela, but apparently a lot of the mothers seem to opt that.
If you compare the way of delivering 20 years ago and now, 20 years ago C-section was very dangerous because we didn't have good medicine to control the bugs, antibiotics. We didn't have safe anesthesia. We didn't have safe blood transfusion facilities. We didn't have good surgeons to do safe cesarean sections. These are some of the limitations that we had in the past. But in the 20 years now, we have very safe medicine. We have safe blood transfusion. We also have a lot of improved techniques in doing the surgery. So these are some of the issues. So all this put cesarean section at a much, seems to be the safest way, but actually it is not. Because when you do a cesarean section, you still use medications with anesthesia. It has complication to mother, to the baby. You still need to cut the tummy. So in cutting, there is bleeding, injury to bowel, bladder. And then there is once you cut open, the bugs from outside will get inside the body. It causes infection. So these are some of the issues that we, even if the mother opts to for a cesarean section on request, even if it is in outside, all the doctors, it's a pre-mandatory requirement that they explain this to the mothers. Then the mothers make an informed decision. If these do happen to them, complications of bleeding, injury to organs, infections, the mothers later, they cannot regret because it has been informed. So this is how it works two ways. In the past, we used to go, we tried to go into a cesarean to save the life of the mother. At a certain point of time, because of improved technology and science, we have gone to not only saving the mother, but also trying to save the life of the baby. Now we have gone even deeper, not only saving the mother, not only saving the baby, we want to reduce problem to the baby. We don't want the baby to be really stressed out and take out. We want take home healthy baby. So these are the reasons that we go much more deeper. So the rate of cesarean also tries to rise slightly up.
A lot of us have a general idea of what happens, but I was wondering if, doctor, you could explain what happens during a C-section in detail, because people think it's a simple operation, and that is, I think, one of the reasons why people also think it's easier to give birth through C-sections. So if doctor could actually explain what goes in C-section.
Firstly, we should be very clear about why we need a C-section. We call it an indication. So that must be good enough to justify that if something goes wrong, still the reason to do a cesarean section stands out. So that's what we call indication. Yes. So if the mother has an indication to do a C-section, let's say if the mother has a heart disease where she cannot undergo a very long long tiring labor process. So we will decide on a C-section where it is justified. Now, second stage is then we need to screen the mother, whether the mother has any other risk factors that may cause problem during the C-section. So this is also checked up by anesthesia team. So 3 teams are involved in having a C-section. One is the gynecological team who will be actually doing the C-section. There is another team which is giving medication so that the mother doesn't feel the pain. This is the anesthesia team. They will check from the anesthetic point of view that whether they should give a spinal anesthesia, epidural anesthesia, or a full general anesthesia, so that if the medicine is given, whether the mother has any problem underlying which may cause further problem. And the third team is the baby team. Then the baby team will also be attending the C-section. They also should know why the C-section is done. After delivery, the baby will be handed over to them. And then the operation theater team is also involved, the fourth team, who actually will be helping with that one. So now in the process that all this clearance has to be obtained before doing a planned C-section. The gynecologist agrees the indication is justified. The anesthesia team checks the mother that she is fit to go. Then the theater are prepared, instruments, everything are prepared. Then the pediatric team is informed, the baby team is informed. Then we go in. So on the day of surgery, the woman and the partner, they have to sign a document that they understand all the consequences, that if something goes wrong, what can go wrong. All will be explained, like process of bleeding, infection, injury, needing to stay longer in hospital. All this will be explained to them before actually having the surgery, and they understand and the risk. This is called informed consent. So once this is signed, then on the day without taking food early in the morning, the patient is taken to theater and the dress all is changed, and the operation dress is put on. Then the patient is put on the table. And then the first one is the anesthesia is given so that she doesn't get. The common anesthesia we give is a tiny needle prick on the back where the injection is injected into her lower spine, so she doesn't feel pain in the lower part of the body. So we can do a C-section. And after that, then we clean her tummy up, medication, then we cover with sterile cloth, and then the operation starts. So the operation is usually done with the incision that is in the low transverse on the lower tummy. We open up the skin and go into her abdominal cavity. The uterus will be, the womb will be there with the baby inside. And we also cut on the lower part of the uterus. And then the back of water will burst. Then we deliver the baby. So the baby is delivered. And then we clamp the cord. And the baby is handed over to the pediatric team. And then we close up. The placenta, after the baby is born, the placenta is also delivered through the tummy. So after that, we clean the womb and make sure the uterus contracts. And if it doesn't contract, there will be bleeding. So we use some medicine injection for the uterus to contract. And once it is clean, then we suture with like stitching. We stitch with the surgical sutures. Nowadays, we stitch only on one layer, the uterus, and make sure uterus is contracted and the wound is stitched back. And then we clean the inside the abdominal tummy with a clean saline. We clean the blood clots, all the clean. Once the tummy is clean, we close back the abdominal wound. That also we stitch up. And then we put a sterile bandage and then transfer her out of the OT. So that is how a C-section.
There's quite a lot of layers you have to go through for the baby to come out. Do these have long-term side effects?
It depends on whether you have a spinal anesthesia, epidural, or a general anesthesia. But most commonly we practice here is a spinal anesthesia. That means a certain amount of medicine is just pushed through a fine needle in between the spine bones in the lower back. Usually, from the scientific point of view, there is no effect because the needle is so tiny. But people tend to forget and blame their back pain on the injection they had during the cesarean section, which is actually I don't agree. Yes. Because during the process of pregnancy, what happens is you are carrying a big baby and your spine is not erect. Your body also goes into adaptation into a lot of curves so that you adjust the weight of the baby hanging from one side. On the other side, your own body weight so that you are able to move on two legs. Yes. So your spine curvature is deformed during pregnancy, temporarily. Yes. And that causes a lot of low backache. So now, during the process of delivery, when you put a fine spinal needle there, and women they complain about the back pain. But then later part of back pain is your body has gone repeated changes through the pregnancy, and at the same time you are also growing older. So there are degenerative changes happen at the bony junctions. So. And at the same time, there are also weight changes in the mother's body. They may be very healthy and around 15 to 20 years with perfect no illness, but they comes back at 45 years where they have excess weight and they have gone through many processes of childbirth, and they are blaming the back pain of the poor spinal needle, which is not true.
Doctor, you've mentioned the Kangaroo mother care. Please explain to us about it.
It was in the 1970s where actually started in South America, in Colombia, where there were a lot of new hospital facilities were not good. Too many babies were dying. So one of the professors, he encouraged that all sick babies who are born, there were not enough incubators. So these babies were kept directly tied to the mother's chest after birth, so keeping with the mother together. So if you look into the animal world, the kangaroo is the only animal that carries the baby in a pouch next to the belly. So that is a direct interpretation of keeping a baby after birth directly in contact with the skin, then with the mother. So that was and that concept in 1970s has reduced the need of expensive incubators. So now that has been again revived in 1996 around that time to actually promote that all the babies who are born should be put to the mother's chest, and they were midwives were trained, parents were educated, some doctors were trained. So it spread out that is a low-cost technology that if you put the baby after birth, clean the baby nicely after birth, wrap it nicely, put a pamper, and then put back skin-to-skin contact with the mother. And sometimes here I have seen not only the mother, if the mother has a cesarean sick, it is put with the father also. So kangaroo mother care, it can be with the couple, either father or mother. So it actually maintains the body temperature of the baby. So if the baby is on the mother's chest, the baby also has a special bonding with the breast, the source of food. So baby will suckle the breast, stay right next to that, hear the mother's heartbeat, and get the temperature maintained with the. So there's a closer bonding, and the reflex of the mother. Once the baby is put on the mother's chest, the mother's body also goes into a state of relaxation, where the hormone of peace hormones they produce inside. And there is increased hormone that goes to the breast, and more milk is also produced. So these are the benefits of kangaroo mother care.